Welcome to Gambling Harms and Domestic Abuse, resource for housing professionals. I'm Natasha Devon. In this series, we're exploring the intersection between gambling harms and domestic abuse, part of a project funded by the Gambling Commission and led by Mercy Denedo from Durham University, in partnership with Amanze Ejiogu from Sheffield Hallam, Chibuzo Ejiogu from Cranfield University, Katy Brookfield from Nottingham University, Liz Riley from Betknowmore UK, and Kelly Henderson from Addressing Domestic Abuse. This is the fifth and final episode in our series on gambling harms and domestic abuse, with a particular focus on housing, looking at a new resource called Gambling Harms and Domestic Abuse, resource for housing professionals. During the previous two episodes, we've explored how housing professionals can recognise and respond to gambling harms and domestic abuse. In this final episode, we're turning to the next step, referring people for the right support, helping residents access the services and networks that can make a lasting difference. With me today are Dr. Mercy Denedo, who is from Durham University and part of the project's research team, welcome, and Nikki Clark, Head of Housing at Standing Together Against Domestic Abuse, who work with housing providers and local authorities to improve the housing response for survivors through their DAHA accreditation and whole housing approach frameworks. Welcome to you both. Mercy, I'm going to begin with you. Tell us a little bit about this research project and your role within it.
So this project is a 2-year project funded by the Gambling Commission. So the emphasis is to understand women's experience of gambling-related domestic abuse and how it affects the housing condition. And in terms of doing that, we spoke to women with lived experience of gambling-related domestic abuse and whether they've used gambling to cope with the abuse that they've experienced and how it affects their well-being, affects their housing condition, and affects their kids as well. Also, in doing that, we also spoke to service providers in the housing sector and also within the gambling sector to understand the nature of support they've been providing to those women with gambling-related domestic abuse, and also to identify the gaps in the service provision in order to provide recommendations to policymakers on how effective the support provided to women. Our emphasis is on women, but we understand that domestic abuse is also experienced by men. And when they are providing support, to understand the gaps and the nature of services that they need to provide to those who are experiencing gambling-related domestic abuse.
And there are 3 R's, aren't they, within the resource for housing professionals. And today, in this particular episode, we are going to be focusing on the refer. And that's about being able to refer people who are experiencing gambling harms and domestic abuse to appropriate services that will be able to help them. When it comes to that step, how can housing professionals support tenants by contacting them to the right services?
The first R talks about recognize, second is about respond, then the third one is about refer. And from the interviews we did, we realized that from speaking to women with lived experience, we realized that one, there's no clear understanding of the nature of support available out there, probably because those providing support are also not aware of the nature of support available to them. And when you look at the refer framework, we've tried to structure it in a way to provide support to housing providers. They need to understand the nature of services available within their local communities and also available nationally, so that when they are providing support, they can easily refer women or those experiencing domestic abuse, not just women, because research has shown that men also experience domestic abuse, to the right support pathways, so that those experiencing domestic abuse can be adequately supported. One, it starts with them understanding the nature of support available out there, the kind of support that can be provided. Then going back to those who are experiencing domestic abuse, understanding that they need to build a credible relationship with them so that those experiencing those domestic abuse can easily disclose to them what they're experiencing and how they want them to be supported. Because from speaking to women, we realize that some of those women, they also want control when demanding, when requesting for support. Some will want to self-refer themselves, and professionals need to understand that if those women, they want to self-refer, they need to give them the adequate support to self-refer and not just take charge of the nature of support they want. So they need to build a culture of trust with those who are experiencing domestic abuse. They need to understand the services available out there. And from the research we've done, women told us that even when professionals, they refer them, there's still gap in the nature of support that they provide, because most professionals, they assume that once they refer and that's all they have to do, there's no continuous support provided. So professionals need to understand that by referring them, they also need to ensure that those women or victims, they don't fall through the cracks. They need to go back to them and still keep checking to ensure that they receive the required support that they need.
That's such a practical bit of advice to know that once you've referred, it's not job done. You need to check back and check that that service is actually providing that individual with the support that they need. Nikki, I mean, Mercy's touched on a few of the challenges that housing professionals face, but are there any others that you can think of in terms of the referral process that housing professionals might come up against?
I think the biggest one initially is that they wouldn't know who to refer to in most cases. So having that in the resource, sort of some help around who you need to look for in your area to give that support is a massive help. I think, the housing professionals will have relationships with mental health services, substance misuse, those sorts of domestic abuse services, and they will know where to refer and they'll have relationships with those people. But with the gambling ones, they wouldn't. So it's no good, in the nicest sense, training them to recognise the signs and then respond to it and offer help. But then if you don't know where to go to, then you can't help the person concerned. And you also have to trust that you're putting that person with the right people, because if you're not sure who you're referring them to and whether they're going to deliver a good service, then that could make a bad situation already worse.
I hear this a lot, having worked with Betknowmore, that people just don't know about the support that's out there for gambling harms, both nationally and in their local area. So I imagine that this resource will be really useful for housing professionals in kind of giving them that network. Mercy, for any housing professionals who are listening who want to access the resource, how can they find it?
For us, we have developed a website called dagamblingarms.co.uk. So this podcast will be available on that website. The resource titled Gambling Harms and Domestic Abuse Resource for Housing Professionals will also be there. And at the end of the project, we have plans to carry out a launch event to invite housing professionals into the room to have a conversation where we'll be showcasing what is available online through this website. So whoever is listening can go download this resource on www.dagamblingarms.co.uk.
I mean, this is the final R, as you say, and I think from having had conversations regarding this resource, I think you can summarize it as have it in your mind that it's an option that somebody might be experiencing gambling harms. Have the confidence to have the conversation and speak to them about it compassionately and with empathy. And then thirdly, and that's what's come out of this discussion, is to know what further support is available specifically for the gambling harms aspect of it. So from everything we've discussed today, it's clear that recognizing, responding, and referring are three connected steps that can rebuild lives. For housing professionals, having the right tools and confidence to make that referral can mean somebody gets the help they need sooner. And that's a powerful legacy for this project. My thanks today to Dr. Mercy Denedo and Nikki Clark for joining me, and to everybody who has been part of this series. I'm Natasha Devon. Thank you for listening.